Hi, and welcome to this week's video podcast. I'm Brent Dodge, owner of Alpine Physical Therapy. I have with me Tara Mund, a physical therapist and the director of the Her Health program here at Alpine Physical Therapy. Tara, we're glad you're here.
Yeah, thank you.
Today we're going to be talking about the idea of women's health physical therapy. And I thought it'd be helpful if you could just describe what that means to you.
So women's health physical therapy is a specialty field in physical therapy where physical therapists are trained beyond just entry-level PT, after-school, additional training, to be able to better address a variety of conditions that happen along a lifespan, more generally in women, but sometimes that can include men as well.
So when people think of women's health, are they aware of what you guys do in women's health physical therapy?
I think it's becoming more and more so, but I think there's a lot of people that just don't know that physical therapists can address these issues and that we're out there and ready to help.
So in general, most physical therapists have some training perhaps in helping in women's health?
Sure. I mean, it's a one semester course that we take in school, just I think more to get PTs themselves aware of what a women's health therapist does and interested, and so if that's something that an individual therapist wanted to do, then they would know about it to be able to go on and expand upon that once they graduate.
Well, you are certainly a women's health physical therapist and becoming a specialist in that area. Can you tell us about the training that you're working toward?
Sure. I'm going through a series of courses to gain my certificate of achievement in pelvic physical therapy right now. I have been working at that over the past year and a half and should finish up early this spring. So it's been just amazing the possibilities that has opened for me in terms of what I can provide to my patients and the outcomes that I can get with the new training that I have.
So how has this very specialized training helped you as a physical therapist?
Well, I think the most valuable thing that I have now that I didn't have before is the ability to perform an internal examination for specific patients when it's appropriate. And basically, what that allows me to do is really to assess directly the area of problem. So if we're talking about patients with diagnoses such as incontinence, pelvic pain, pelvic organ prolapse, I really need to get to the source of the problem to be able to better diagnose and then treat those patients.
Well, it's certainly not something I remember learning in physical therapy school.
Sure. So, I usually like to describe it as if you came into me with a shoulder problem and you needed physical therapy for your shoulder, I wouldn't just start throwing exercises at you or give you general recommendations. I would really want to be able to assess the shoulder, know how well it moves, know how strong you are, and then from there give you appropriate exercises to do versus just blindly picking them. So when I do an internal examination, I'm able to really assess the function of the muscle. Is it contracting? Pelvic floor muscles contracting. Are they relaxing? What's the resting tone of the muscle? Is it hypertonic? Is it, really lax? Is it, thick? Is it strong? How strong it is? I can grade exactly how strong the muscle is. From that grading, I can give the patient a specific exercise program. So if you're going to take the time to do the exercises, you want to know that you're doing the exercises correctly, that you're doing the right amount of them, that you're holding them for long enough to actually get what you need. And from my examination, I can give you an individualized program.
So really, before gaining that extra specialized training, it was kind of seek and find and maybe just provide some things without really knowing what it was that you were dealing with and potentially helping or not helping.
Sure. I mean, I was willing to help people, but my resources were somewhat limited, and I don't think that my treatment was as effective as it is now.
Tell us a little bit more about that certification. I mean, obviously this is well beyond just entry-level information and practical knowledge that you're gaining. How does it work? Do you go somewhere for like a week or 10 days? And if so, how many times do you do that?
Sure. Well, they're 3-day courses, long days. early morning to late evening, and they're hard to come by. They are in big cities and mostly on the East Coast. You have to travel quite a bit to get to them. In between the courses, I've been working on this for a year and a half. I've really taken my time to make sure that I can absorb each of the set of information that I was given, and not just kind of trying to get it done as quickly as possible so that I have a chance to implement it and refine my skills before I take it to the next level each time and add to that knowledge base.
Well, there's certainly a world of difference between entry level and the specialization that you're working toward. How have you seen what you've learned and what you've gleaned in terms of helping your patients?
I think in the last 6 months, most specifically, what jumps to mind is I've had a few patients who have been dealing with urinary incontinence and actually pretty severe symptoms when you take what they were going through and what they were living with on a day-to-day basis. And they honestly just did not know how to contract their pelvic floor. They had never tried to do anything about it. They were just living with it and just kind of, unhappily living with it, but they decided to take the step and get the help that they needed. They came in, I taught them how to use their muscles. They did the exercises that I asked them to do. They did them faithfully, and within a month, 80 to 90% improvement. And we know that strengthening can't happen that quickly, right? It takes time to build muscle. They had the muscle, they just didn't know how to use it. And not only did they not know how to use the muscles, they were doing the opposite of what they should be doing.
So really almost a training effect.
Training effect,
Amazing.
Yeah.
Tara, is there a common misperception that people have about women's health physical therapy?
Well, as we talked about before, Brent, I think a lot of people just don't even know about women's health therapy. But in terms of these women that are dealing with the diagnoses, I think that they are a lot more in tune with options surgically or medication, prescription medication wise, and just don't even know that that is out there and accessible to them. I think that a lot of people, especially dealing with things like incontinence, are just either unaware of what they can do to help themselves, or just think that it's a normal part of daily living and it's not really something that even needs to be dealt with when there's simple things that they can do to dramatically impact their quality of life.
Now, you'd mentioned to me previously about an article that was written in Europe, I believe.
Yeah, so that article is one of the really interesting points I like to tell patients about, to give them the motivation and the faith that this is something that they can get on top of. It was a study that was conducted in Europe, and they were requiring that patients went through 4 months of physical therapy before they would cover any sort of surgery to address incontinence, such as like a bladder sling. And after those 4 months of physical therapy, over 80% of them ended up not being surgical candidates because they took care of their symptoms on their own. So I think that's extremely powerful.
80%, the proof is in the pudding, and the fact that they were actually required to go through formal physical therapy, and 80% of those people ended up not requiring a surgery that may have otherwise been done. Mm-hmm. That's phenomenal. Well, Terry, you've helped answer a lot of questions that people may have in their mind, and may have raised other questions that people may have, and that's why I want to direct our viewers to the Her Health website, which is herhealthmt.com. And be sure to visit our clinic website at alpineptmissoula.com. And I just want to say in closing, thanks again, Tara, for joining us for this podcast.
Yes, thank you.